I'm Dr. Scott Fuller. On this segment, I want to revisit lower back pain, and I have some recent cases that I want to present to you. On this show in the past, I did a nice long show on low back pain, and I talked about some cases, and then I talked about how we resolved them in my office with chiropractic care and exercise and so forth. And on that prior show, I discussed a 91-year-old, an 81-year-old, and a 35-year-old with acute lower back pain. And we had great results in all the cases. If you missed that show, you can go to my YouTube page and you can watch that video called Low Back Pain. On this particular show, I want to bring up 4 cases for you. A 43-year-old man, a 68-year-old woman, a 39-year-old man, and an 83-year-old woman, all of them with lower back pain. You're going to see some consistencies here. There's some very important lessons for all of us on what happened with each of these cases and what we all can do to improve our health and the health of our spine as we move forward. So, case number 1, a 43-year-old man, he has acute lower back pain and he calls my office. He was playing soccer and he did a quick stop in soccer and he felt the jab of lower back pain immediately and he has since been crippled. So he does what a lot of people did. He thought maybe this will go away, so he gave it a week and he's completely crippled and it's not getting better. And he calls my office. Now he calls my office because 4 years prior, we worked on his chronic neck pain. He had chronic neck pain for 3 years. He went to his primary care physician, he had x-rays, the x-rays were negative. He had an MRI, the MRIs showed bulging discs. He had some physical therapy, which actually helped, but it didn't last. He had more physical therapy later on down the road, which again also helped, but it didn't last. He had a cortisone shot in his neck. This is all before he came to see me. Cortisone shot in his neck didn't help. Finally, as a last-ditch effort, which a lot of people do with chiropractic care, he calls my office. We worked on him, completely resolved his neck pain in 10 visits, and it was fine for 4 years. So he remembered, hey, I need to call Dr. Fuller. So he calls my office for this new lower back problem. And he's crippled. His pain is a 9/10. He can't walk. He has difficulty walking. It takes him a half an hour to get out of bed in the morning. Unfortunately, a lot of you watching this show have been there before. I've seen my parents go through this and so forth. So he comes into my office now. His pain is so bad and he's so crippled, I can't even do my traditional chiropractic on him, which would be put him on my chiropractic table. I do manual treatments and manipulations. That would be the ones that people think of when they think of chiropractic, the pops and cracks and snaps. Couldn't even go there. He was just too far gone. So he could only sit for an examination and sit for treatment. So I did a couple of treatments the first week. I saw him every day, and I did something called a cold laser. I'll be doing a show on that in the future. But it's called a therapeutic laser. You can look it up online. Low-level laser therapy is also another name for it. And the machine that I use in my office, it's from a company called Urconia. Urconia.com with an E, Urconia.com if you care to look at the research and so forth. Anyway, so I use a therapeutic laser and I use a chiropractic instrument, a light force instrument. It's a light tapping type of stimulation to the nervous system. So that's all I did the first week because that's all I could do. And sure enough, at the end of the week, he was 70% better. Able to go back to work, he could sit at work for a while and so forth, and he has a newborn baby, he could lift the baby again and so forth. I mean, big things happened in 1 week. So now we're 2 weeks into it, he's 80% better, and his pain is down to like a 3/10. So we still have some work to do, and now I can do some more traditional chiropractic techniques on him. Second case is a 39-year-old man. A few weeks back now, here's the important lesson with this one. A few weeks ago, he did a very popular home exercise video program. One of those ones that's kind of shorter and higher intensity. So he does one a few weeks back, and his lower back hurts and aches after that workout. Over the course of a week, it resolves and it goes away. A week later, he does the same workout on a Monday morning. Feels pain in his back, and by Wednesday, he's completely crippled. Unfortunately, he's away on a business trip, so he goes to the emergency room. He's given muscle relaxers and so forth. Difficult sleeping. He had a bear of a time getting home and so forth. Now he can't work. He ends up in my office. His wife was already a patient of mine, and she said, just go see Dr. Fuller. Okay. Kind of the same situation as the first case. I couldn't do much for him because he could barely walk in, and he sat at my table, and that was about it. Couldn't do my traditional chiropractic techniques on him. So I did, which happens to be coincidentally, the same treatments. My light force chiropractic instrument and my low-level laser therapy. And in a week, he does particularly well. He gets 80% better in 1 week. And we're about 3 weeks into his care, and he's 90 to 95% better. He's back traveling for work and so on. He's can play with the kids at home and so forth. So he's doing a lot better. 2 terrible cases. We're going to talk about in a minute what caused their pain, why they're in pain, and how we dealt with that. But before I do that, I want to say, does everybody get results in a week or 2 like these 2 cases? Absolutely not. Let me give you a more typical case. A 68-year-old woman comes in. She has lower back pain. Now, she's had lower back pain episodes in the past, but they all resolved fairly quickly and with chiropractic care. But this time, a few months ago, she was starting a lawnmower, pulling on the cord really hard, right? And of course, she sprains her lower back. More on that in a moment. And now she has lower back pain and leg pain. The other 2 cases, by the way, they didn't have any leg pain. They just had lower back. In this case, she had lower back and leg pain. Okay. So what does she do? The pain is a 5 to 7 over 10. She has difficulty sleeping and turning over in bed. She goes to her doctor. She receives x-rays, diagnosed with moderate to severe degenerative disc disease, subluxations of L4 and L5 on x-ray, says the MD. In 4 weeks, she is 30% improved. So I'm working on her 3 times a week for 4 weeks, and she's 30% better. We have 70% to go. Her leg pain is less, her lower back pain is less. It's still there, it's still nagging at her, and it's still pretty significant, but at least she's heading in the right direction. Okay? We've got a couple, 3 months left of care in her situation here. Okay? So we have 2 acute back pain cases. They get better quickly. We've got another acute back pain case. She's going to be a few months to get to resolve, but we expect a full resolution in her case. Here's a case that didn't respond, and not every case responds to chiropractic care. That's the unfortunate thing, and it is an 83-year-old woman. She comes in. She is such a doll of a woman. She's just so pleasant to be around, even though she's suffering terrible. Her pain is a 9 to 10 over 10. It's in her back, in her hip, and her leg. She's walking in with a cane. 3 months prior, she fell off a chair onto her hip and her leg. Terrible pain ever since. She's had pain problems in the past, but this really sent her over the edge. She gets the x-rays. X-rays didn't show any fractures. Gets an MRI, disc herniations and bulges and wear and tear and rust and all the other kinds of things going on. So we start working on her, and we work on her for about a month, 3 times a week. We're making a little bit of gain, but it's not holding. She's really suffering. She can't sleep. She can't walk, and so forth. So we eventually sent her back to her primary care physician. She's getting looked into right now. So chiropractic doesn't work in every case, and unfortunately in her case, the injury and the deterioration in her spine is just too great for us to help. So I just wanted to present that case to you. Not every case gets well. I would say that 99 out of 100 cases that come into my office do get better, and they get better without drugs and surgery, and that's a good thing. So what is consistent about all of these cases? Well, I'll tell you. This is what happens in the acute back pain cases and in the chronic back pain cases. I usually diagnose somebody with a sprain strain in the lower back, a sprain strain. My other videos will talk about this in depth, but just as a review, a sprain strain means all of the soft tissues associated with the spine are involved. It also means the discs. The discs are the #1 source of lower back pain, whether it be acute, in those cases that I said earlier, even though it resolved, it's still disc pain. Or whether it's more chronic, like the other 2 cases, it's still disc pain. Are the other tissues involved? Are muscles involved? Yes, they are. Tendons? Yep. Ligaments? Sure. The joints on the back side of the spine that allow us to move, are they involved? Yes. But what's the #1 source of pain in all of these cases? It's the disc. A surgeon wanted to do an experiment to determine exactly what was causing the patient's pain. This person needed back surgery, okay? So during the surgery, the surgeon is sticking a needle in different tissues to determine exactly where the pain was coming from. So we put it in the skin. Hey patient, does that hurt? Patient says, yeah, that hurts. Is that reproducing the pain that you're having? No way, not even close. That's not it, it's not the skin. He sticks the needle in the muscle. Is that causing you pain? Well, yeah, of course, that hurts too. Is that reproducing the pain in your back? No way, not even close. Goes to the deep muscles, same thing. Is that causing pain? Yes, it is. Is it reproducing your lower back pain? Nope. Not until the surgeon gets to the disc and gooses the disc with the needle and asks the patient, hey, is that painful? The patient says, oh yeah. And is that reproducing the pain that you've been struggling with? You bet, that's terrible pain. Well, he didn't do that in one case. They did it in 700 cases. And these were volunteers, by the way. Would you like to volunteer for that? Anyway, 700 cases, and every single time they determined the number one source of back pain are irritated, inflamed discs. The other important piece of this is this. You can do an MRI, you can do an X-ray, and you can have one of the 5 discs in the lower back that looks really bad on X-ray. It's degenerated, it's dried up, it's herniated. That one might not be the cause of the pain. It oftentimes is, but it might not be. They can stick a needle in that one. No, that one with the herniation's not all bad. They go to the one below. Oh, that one's definitely reproducing my pain. And in some unfortunate cases, it's several of them. Okay, that's what's going on. So when I use the word lower back sprain strain, that includes irritation to the discs, and that's what's causing your pain. The ligaments are involved, the joints are involved, and the muscles and tendons are involved too. So a lot of people will come into me when they're in acute pain, not like this. They come in what we call the question mark. When somebody has terrible pain, they walk in like this. Yeah, you know, I was starting the lawnmower, or I raked leaves, or I lifted an air conditioner, or I shoveled snow, or one of the 1,000 things that we tend to do. Recent one was cleaning out the attic, another one was lifting boxes, and so forth. So they come in like a question mark. Now, did the disc do this? Ultimately, yes. The irritated discs are driving the pain circuits in that area. They send messages to the muscles which say, hey muscles, protect me, and pulls you over to the side like this. So the muscles are in spasm, you betcha, they are in spasm. But are the muscles the primary source of pain? No, they're not. People will often be given muscle relaxers, and maybe they need them for this crisis situation because they can't get comfortable and they can't sleep. So a muscle relaxer can be used in this situation, and then over time, the question mark kind of goes away. So what I find is I'm working on people, they're like this, and as we're able to work on them with a variety of chiropractic techniques that we have, we notice that their posture gets better. And people notice that at home too. They just see people standing up straighter and so forth. Other people come in with the antalgia, meaning the terrible posture, in this direction because they can't stand up straight because that disc inflammation down in the lower back as well. So they get it this way. And some people have the combination of the two. They're bent over to the side, the question mark, and then they're also bent over like this, and they're coming into my office all broken and battered like that. So that's what's going on. Disc irritation is the cause of almost everyone's back pain. So I call it a lower back sprain strain, but ultimately it's a disc problem. How do our discs get this way? Well, they get this way from slow wear and tear processes. It's how we sit, right? We sit all day for our jobs. Sitting is the new smoking, and that wears down on our discs and joints. If we are out of alignment and then sit, it'd be like driving your car with a misaligned front end. Eventually those tires are going to wear down. They're going to wear down before you get 50,000 miles out of those tires. And then after 20,000 miles, you might start getting symptoms or pain from those tires. They might shimmy down the highway, vibrations, they might squeal around the corner, and things like that. So they will eventually give you symptoms and pain. The important lesson there is the symptoms and pain shows up last. The disease and wear and tear process is going on for a long time unannounced. Oftentimes, lifting up those boxes or changing the bed sheets or pulling the cord on the lawnmower was the straw that broke the camel's back, right? So that's the last event that we remember. But it's the 10,000 times prior to that we were starting the lawnmower, lifting the boxes, and carrying around the air conditioner that added up to this problem that we're having right now. So what do we do in a chiropractic office to correct these things? We have a variety of techniques and tools in our office. Similar to a physical therapist, physical therapists don't do just one thing. They have many different things that they can do. And in a chiropractic office, we have the same thing. We have many tools at our disposal to use. So we do orthopedic neurological evaluations when you first come in. I take a thorough health history. I'll do chiropractic checks, postural and spine range of motion checks if you can. Those acute cases couldn't even do anything. If necessary, I'll take x-rays if you hadn't had them in the past and so forth. Then I'll give you a working diagnosis. Usually that diagnosis, if you come in with a back problem, is a lower back sprain strain. And if you were a patient of mine, I would carefully tell you it's the discs. And don't count on this getting better in a day or a week. Some of the cases will, but oftentimes they don't. A sprained ankle might take many weeks or even a few months to get better, and that is a sprain of ligaments and cartilage and tendons and muscles, right? Well, the back is no different than your ankle. It's just that there's a lot more moving parts in the back, right? There's a lot more joints and ligaments and tendons and muscles and so forth. So it's the same diagnosis, sprain, strain. It's going to take time for those tissues to heal up. I know we don't have time. I wish everybody got better in one visit in my office. They don't. If they did, the line to see me would be out the door and down the street like Starbucks. You know, that'd be wonderful, but that's not the case. So then in my office, we do drop table work. That's light force. We do chiropractic instruments. That's also light force. I mentioned earlier we do a cold laser therapy as well. That's something we do in my office. And then we have traditional chiropractic techniques, the manual adjusting and manipulation. Not every patient gets those. We pick and choose the patients that receive those types of adjustments. An 83-year-old woman that I mentioned earlier is going to get different care than a 38-year-old woman or man. And that's going to be different than an infant. And I work on infants and children in my office too. They receive different treatments and adjustments as well. So those are some lower back cases that I have in my office. The thing we try to do in chiropractic, particularly in my office, is prevent things from occurring. And that's why after we deal with an acute pain situation, we try to educate people and let them know, after the car you've blown the engine, we've repaired it, now let's change the oil on a regular basis, even though it's running fine. Your teeth are feeling fine right now, you're going to brush them 3 times today, and you're going to floss them, and you're going to go for your dental checkup. We recommend a similar car care philosophy and a similar dental care philosophy to your spine and your overall body and health. Take care of things now so you don't end up having one of those catastrophes that I had mentioned earlier. You take care of yourself with wellness chiropractic care. Come in for adjustments before your pain gets bad. We recommend ongoing daily spine exercises. I've done those exercises on this show. I will do them again on this show. And you can go to my YouTube page and watch videos on those. I write on my blog. You'll see my blog up here as well. I continuously write on how to take care of your body and your spine and your ergonomics and so forth. And then we also have people take care of their nutrition, their general physical exercise, reducing stress, and better sleep. That's what we do in my office. I'm Dr. Scott Fuller. Please join me again.